Hello, everyone. I think we're going to get started. It feels weird holding the mic just because there's not that many people in the room, but folks on Zoom can't hear us without the mic. Um, but just want to start by saying thank you, everyone in person. Our friends are on Zoom. Thank you all for joining. My name is Dalwin Corsino, he, him, his pronouns, and I am chapter president for Brothers in Public Health. And this is our inaugural chapter in the greater Boston region. So we welcome you all to the Brothers in Public Health family and the community. We hope that you enjoy the conversation that we'll be having today. I just want to say thank you for joining also, because you're coming either from school or work. So you've gone through a day. So thank you all for showing up again in person and virtually. I'm going to pass it over to Savion to introduce himself, and we'll go from there.
Thanks, Darwin. Well, hello, everyone. I'm Savion Thompson. I am an intern for Brothers in Public Health for this year. I've been in this position since February, and I've enjoyed every moment of it. So once again, thank you all for being here today. I'm also an MPH candidate here at Northeastern. So this campus you're looking around on this building, I go here. So pretty big, and I enjoy it here as well. And so just going a little bit more into who Brothers in Public Health is. Brothers in Public Health is a 501(c)(3) nonprofit organization. I think I could, I don't know if y'all can see the difference on the screen. There we go. Here we go. All right, perfect. I'm not going to bore you with the details of how we. There we go. Some technical difficulties, but I'm getting there. Okay. But I'm not going to bore you with our vision and our mission. I think you all can read, but just about how we go about creating the community that we're looking for. So we're thinking about brotherhood. We're thinking about establishing and creating the community that we want for each other. And then I'm thinking about why we want to establish this community. So when you think about men of color, you think about how often they're discriminated against. And so we're thinking about why we need to stick together and build up the community that we want to have. And when we think about wellness, we start thinking about the different impacts that mental health has in terms of physical health. And so those things start to become more and more difficult to do. And so at Brothers in Public Health, we want to continue to establish health equity, scholarship, professional development, because men of color are more likely to live in poverty, miss out on educational opportunities, and have limited access to professional development. And so as we continue to develop the community and stand with each other, what we're trying to do here today and what we're trying to do at Brothers in Public Health is to empower one another and build up that community that we have. And so building off of the community, and so why is it so important? And so when we started, it was about a year and a half ago, we started thinking about all the graduates for public health, and they're only 10% of all graduates with public health degrees are men of color, or people of color in general. And so when we start to think about that, we're in our classrooms, and one time we started thinking about all these different things. The things that we're talking about, they are for men of color. They're about men of color. They're about communities of color. And so when we come to address those issues, we want to make sure that we're at the forefront of that as well. And we're not just in the background and just hearing these things and having other people do this. We want to be a part of those change agents. And so Brothers in Public Health has 3 strategic objectives. The first is to build awareness, research and advocacy, and development. And so I'm not going to go into every detail about everyone. So I'm just going to highlight maybe 1 or 2 of each. And so when we think about building awareness, we're starting to think about health inequities among men of color. And I'm going to keep it specific to like Boston, Massachusetts area, since that is where we are. And so we're going to start off thinking about just for like health inequities among men of color. So we start to think about the communities that we're in. And so more and more now than before, we're starting to understand that our zip code is more important than almost our genetic code. And so in Boston alone, we start thinking about Roxbury, the difference between life expectancy in Roxbury and Back Bay. And so if you're in Roxbury, your life expectancy is at 69 years old. And when you go to Back Bay, the life expectancy goes up to 92. And those are just 2 communities that are 2 miles apart. And so that's some of the awareness that we need to bring to our community. And then for research and advocacy, advocacy, we're going to look into healthcare access. And so Boston, of course, is a healthcare hub. And so we start to think about all the hospitals that we have around: Brigham and Women's, Mass General, Beth Israel, Dana-Farber. All those are really good facilities, but the only one really serving communities of color is Boston Medical Center. And so we really need to continue to expand access to healthcare and do research and advocacy there. And then we also, when we start thinking about employment, we also have to think, like I said, we are in a healthcare hub, and we are in Massachusetts, which is a really good state for public health. So we want to make sure that we're getting men of color into those areas, since, like I said before, missing out on educational opportunities and professional development. And so now with development, looking at how to establish this operation. So that's what we do here. That's what we're here for. And for the first time, this is our first event and our first chapter in Boston. So we're super happy about that. But that's just how we get chapters to run. So that's how we get new chapters in other areas. And of course, we're always looking to expand. And so we're happy about that. And then of course, raise your hand if you are a student actually. Yeah. And then raise your hand if you weren't a student. So that's everybody. So we're happy to always look towards creating scholarship opportunities for people of color as well. And so that's something that we look to do at Brothers in Public Health. So I've gave y'all a brief overview of Brothers in Public Health. So now I'm just going to go into our panelists. They can go ahead and join me on stage. So we can give them a round of applause as they join. So we have Dr. Carlos Copas, which is the Chief Behavioral Health Officer at Lynn Community Health Center, and he's also a member of the Health Equity Compact, excuse me. And we also have Mr. Kirby Valentin. He serves as the Senior Manager, Contract and DEIB of the Massachusetts League of Community Health Centers. And we also have Dr. Maniar, my professor, professor of practice, and also he's the director of the Masters of Public Health program here at Northeastern. So I'm going to turn it back over to Dalwin, and I hope you all enjoy our panel.
Wow. Thank you all. So many different roles, so many different settings that you all work in, different backgrounds, educational, how you got to where you are. But before we get started, can you please start by kind of sharing a little bit about what you do, and how did you get into public health?
Sure, go ahead, please start.
All right, can you hear me? All right. First of all, thank you, Sevian. Thank you, Dalvin. Honored to be here in your inaugural chapter. I just wanted to say that Dalvin and I go back and have done crossed some paths in some of our work. And as soon as he brought this opportunity to just have a conversation around building community, I was like, sign me up. And I think the conversations have continued to grow. And I hope that from our discussion here and my fellow panelists here, that we can continue to grow, because as Savion was mentioning, in terms of what I've gotten to know about Brothers in Public Health, this is what we need in terms of continuing to build more and have more representations of us. So I'll tell you a little bit about myself. Again, Carlos Cappas. I am the Chief Behavioral Health Officer at Lynn Community Health Center. I am a psychologist by training. I was born, raised, and trained in Puerto Rico. And I say that because as part of the work that I do, that is the lived experience that I bring into really getting to understand how to advocate for policies, processes, as well as for things that will really enhance our ability to diversify the workforce. But in this case, how do we get more people of color into public health? And so right now I oversee a behavioral health department north of the city. And we are basically a community health center, a federally qualified community health center, overseeing about 42 of Lynn residents. Myself, our department is essentially physically located. We have behavioral health services, so that's therapists, psychiatric providers, in all our primary care teams. So we're integrated and providing integrated care services. We're also located in 17 of Lynn public schools, providing behavioral health and medical services. So really getting into where is it the need, the most need that there exists. Let us be there so that we can facilitate access and make it seamless. And we also have a pretty robust community support programs that ensures that all of our patients are not only assessed for social determinants of health, but they're also being connected to community-based services via our community health workers, peer recovery coaches, and our care coordinators. And last but not least, Savion did mention that I am a member of the Health Equity Compact, which we are a group of about 80 leaders of color across Massachusetts, really advocating and advancing health equity via many across industries and via many areas, be it advocacy, be it policy, and all across health center and many cross industries. So I think as we think about building community, these are some of the things that I hope we get to touch base a little bit and share our experience so that we can continue to build on the great work that you all are doing. Thank you.
Hi, everyone. Kirby, Valentin. I work for the Mass League of Community Health Centers, where I do contract management work and also lead the DEIB programming. For those unfamiliar with DEIB, it stands for Diversity, Equity, Inclusion, and Belonging. And prior to my work at the Mass League, I worked for the State Department of Public Health. And I decided to work in public health because I saw the way a lot of illnesses and diseases are destroying our communities. And I always wanted to do work to address those health disparities. And I wanted to do work in the DEI space, in public health in particular, because I feel like Black and Brown people aren't properly represented in the healthcare industry. And I really wanted to do work to really change the face of healthcare and really give us a seat at the table so we can help in the decision making in healthcare and really help address a lot of these health disparities that are happening in our communities.
Hi, everyone. Neil Maniar. I'm a professor of public health practice here in the Department of Public Health and Health Sciences here at Northeastern, and I also direct the Master of Public Health program. So I've been at Northeastern for 8 years, but I came to academia after actually a career outside of academia, working in a large national nonprofit, the American Cancer Society, and then prior to that, Brigham and Women's Hospital, and prior to that, the Mass Department of Public Health. And through all of this, my work has really focused on a couple of big themes. So one is, trying to figure out how we can develop large-scale sustainable initiatives to address some deeply entrenched public health issues. So everything from violence to health disparities to cancer. And through this, what really became a common thread was the importance of addressing social determinants of health and really trying to get as far upstream as possible as we're developing solutions to these issues. And that's one of the things I love about being in academia is not just it's definitely the opportunity to work with students and with faculty, but to really figure out how to try new ideas and how to come up with new solutions to these issues that we've been facing for so long. And certainly over the course of the pandemic, we learned a lot of lessons through the pandemic, but I think there were two that emerged very powerfully. So one was the importance of investing in public health infrastructure, and the other was the importance of really making sure that we do everything that we can to have as diverse a public health and healthcare workforce as possible. Because we talk a lot about racial, we talk a lot about cultural competency, and that's a theme that you often hear. But one of the things that has been shown to be so important is the importance of having racial and cultural and linguistic concordancy between individuals who are providing the services and those being served. And we saw during the pandemic that that is such an important element of building trust. And that's one of the things that I love about being in the academic setting, is to be able to help individuals as they're embarking on their own public health journeys. At Northeastern, one of the things that we're doing, and there are many schools and programs around the country that are really focusing on figuring out how we can increase access to a public health education, how we can create stronger and better pathways for individuals to pursue their public health careers. And one of the things that we've done here is to try to create different models. And I'll talk about that later for sure. What got me into public health was actually the fact that I thought for a long time I was supposed to go into medicine. And like, every good little Indian kid, you're either going to be a doctor or an engineer. And so it was really kind of to the disappointment of my parents when I said, hey, I really don't think that this medical school thing is what I want to do. But it was the mid 1990s. And I was working in New York and seeing the issues that were around me. And we didn't have the internet back then, which is the other thing that some of my younger relatives have a hard time believing. But I started looking up public health programs and started learning more about the field. And I look back and I'm like, gosh, 30 years ago, I had no idea just how powerful this field is. And when I talk about public health, I'm talking about very broadly. And that's the other thing is, there's so many different fields that intersect with public health. And there's really a role for everyone to improve the health of individuals and communities. And that's the other thing that's really exciting about this.
Wow, can we just get a hand of applause for all of this? Thank you all for sharing and introducing yourselves. I realize I didn't share where I come from as well, but I am workforce program manager at the Massachusetts League of Community Health Centers along with Kirby. But we have a lot to dive into right now. You all mentioned so many hot topics, the idea of cultural competency, building communities for providing services in all settings, communities, schools, bringing everyone else together into the field, and how public health is such a powerhouse. So from your perspectives, what are some of the most pressing issues in public health affecting men of color? And any of you can take that along. Go ahead, Kirby.
I could start. So there's a lot of issues that immediately come to mind for me. So like hypertension, that's one. Cancer, for sure. Gun violence, that's a big one. I would say the issue though that I really want to focus on right now is diabetes. So diabetes is a public health issue that's really destroying our communities. I know for Black Americans in particular, Black Americans are 60% more likely to be diagnosed with diabetes than white Americans. And for the Black community, Black men in particular have the highest rates of diabetes. So for all the men that are here and that are watching virtually, I encourage you to get your A1C levels checked, your blood glucose levels checked. Get these things checked regularly. Make sure you're really focusing on exercising, eating a balanced diet, because these are things that could reduce your risk of developing diabetes, because diabetes can be very harmful. A lot of people don't talk about how diabetes can lead to blindness. It can increase your risk of developing hypertension. It can also lead to kidney damage as well. So that's why I wanted to focus on discussing diabetes today.
Yes, totally agree with that. And I think I'm gonna bounce off some of the things that you said, because for me, it goes back to how everything intersects. You mentioned that, Neil, right? And how everything is just not in its silos. So for me, I always go back to mental health, but I wanted to take it a little step back. And how is that kind of the major public health issues that I see? Going back to what was mentioned around the pandemic. At our health center, we basically became the public health arm of the city because of how busy our hospitals and emergency rooms were. So we really wanted to make sure that we were the ones. If they needed us to test for COVID, we were that. If it needed us to give the vaccine, we were that. But that also really highlighted a lot of the issues that were historically present, and it had to do a lot with public health. It had to do a lot of accessing a lot of the things that we need in order to get access and try to be healthy. Like, how do you get to a community health center, to your primary care physician, or to your primary care provider? So a lot of those things that intersect, but for me is the fact that mental health, along with diabetes, along with other social determinants of health, is often overlooked. And what this actually creates is somewhat of a snowball issue that we are not necessarily we're treating the diabetes, but are we really figuring out, are you not taking your medications but because you're struggling with some anxiety, or that you actually are not wanting to because you don't feel that good about yourself? So really not building our ability to screen folks, but as it goes out of our clinic or out of the medical practices, are we really sharing what mental health issues are in our communities? Can I sit here and ask any of you, have you actually been, or have anybody actually informed you what major depression is or generalized anxiety disorder? And how does that impact your ability to see yourself caring for whatever medical condition, or even going to the doctor or to a primary care provider to get routine care? So I say that because, as you mentioned, diabetes, a lot of my medical colleagues often say, if you are not treating depression or someone with diabetes, you're not treating diabetes. And there's a lot of research and a lot of studies that also been done about particularly populations of color, but I will center on men of color that have had any heart disease or have been in the hospital, that often post a either a heart attack or any heart condition that really complicated that needed to be seen in the hospital. The recovery is really tough. And in caring for yourself, you often forget, or we are not really making sure, have you lost pleasure in doing things? So you feel down or depressed for the past, and we're not screening for all those things that are actually maybe even contributing to their lack of caring for themselves. So I think for me, it boils down, I think social determinants are actually often the root of all of our public health issues, or most of them. But I think we really need to center on integrating all of that information, so that the diabetes, the hypertension, and all of the things that you've mentioned are also being considered as we really assess for mental health issues. So
Picking up on both of those, we often hear Massachusetts is one of the healthiest states in the country, right? It's usually at the top of whatever list there is out there of healthiest state, best state to live in. Well, depends. If you're a Yankees fan, probably not. But there are significant disparities that are masked by those data. And so one of the things that I think is such an important issue and a growing issue. So cancer rates are increasing. Survivorship from cancers, a number of different cancers, has gone up. We're getting better at treating cancer. We're getting better at identifying cancers early, but the rates are increasing. And not only are the rates increasing, individuals are being diagnosed at younger ages, and especially when we talk about colon cancer and breast cancer. In both of those, there are significant disparities in outcomes, but importantly, significant disparities in cancer screening. So when we talk about colonoscopy screening, for example, one of the most important screening tests you can get at what used to be 50, but is now 45, but a really tough test on a number of levels. The logistics of getting the test, you have to take time off from work. You need someone to drive you to and from the test. There are all kinds of things you have to do in terms of the prep for the test. Similarly, with breast cancer screening, there are often many barriers to getting that screening. Those are really important issues, because as the rates continue to go up, as individuals are diagnosed at younger ages, if we don't tackle those disparities, the disparities will become wider and they will become deeper. And we will see more individuals who are being diagnosed at a later stage where it's much more difficult to treat. And it's hard because sometimes there's these assumptions made in communities that, oh, this community is doing really well. But within that community, there may be populations that actually are experiencing significant disparities. So to really be able to look beneath the data and to understand, okay, well, is everyone really doing well? Is everyone doing as well as they could? How do we ensure that we are not only increasing access to screening and to treatment, but making sure that we are providing information in a way that individuals can use that information to make informed decisions about their own health? We learned this through the pandemic. There was a flood of information during the pandemic. We did a pretty good job with some of it. We did a really bad job with some of it. And it's hard, how do you explain the technology behind an mRNA vaccine in a way that it becomes accessible? But it was really important for us to do that because that was a really important decision that individuals had to make about their health. So as we think about cancer screening, as we think about screening for other types of illness, it's really important that we also look at how we are providing information, how we're improving health literacy, so that everyone has access to information regardless of their language or their literacy level or their background, that they can use that information to make informed decisions about their health. The other thing that I think is a really important issue, and this picks up on the mental health piece, is the importance of understanding the impact of trauma on individuals, not just at a specific point in their life, but how it impacts their lives over the course of their lifespan. There's a lot of research that shows that when young children are exposed to trauma, either directly or indirectly, that it can actually impact the architecture of their brains as their brains are developing. So key regions of their brains the development of those regions can be impacted by that exposure to trauma. And then that has a compounding effect over one's lifespan. So there are ways to mitigate that, but it's about understanding first the impact that trauma has and creating environments that are trauma informed and trauma sensitive. And I think that's where entire communities, and I think that's where as a discipline, the field of public health can play a really important role because, again, there's so many different sectors that connect with us, right? So how do we partner with education and housing and workforce development and all of these other sectors to really help raise awareness about this? Because there's this assumption, again, that, oh, well, if we provide treatment at this one point in time, they're going to be okay. And that's not the case. We really need to make sure that we understand the effect over one's lifespan of some of these exposures.
If I may, because you're inspiring some thinking and maybe eventual conversations to be had in regards to how do you address, in particular, as you talk about the trauma in children. I think there's really good opportunity to work across in terms of public health and the work that a lot of hospitals, but particularly health centers and primary care practices do, because I also see we need to get better at the data. We need to get better at collecting the data so that we can understand the differences across populations and how we treat and what their needs is. But as it relates to kids and trauma, the pandemic, you can attribute trauma for children that had to do school via Zoom, that were not able to socialize in a critical moment in their lives, particularly teenagers, right? So my public health concern is what's going to happen 10 years from now. Because right now, unfortunately, the mental health system is so drowned. We cannot meet the demand of the needs that our kids need right now. So what from a public health perspective, what is that going to look like in 10 years when they're adults or young adults? And maybe, or ideally, that it has some help or some screening or some level of intervention. But unfortunately, we know it's not going to be the case for everyone. So I wonder, what can we do now? I think we're trying to build our workforce, but it's going to take some time.
That is such an important point. I'm so glad you raised that, because I think as we think about the challenges that we're facing, one of the big challenges for all of us is to really understand that there's this idea that the pandemic is over and we've all moved on. And in many ways, we have. But the impact of the pandemic on so many individuals, on so many families, on children, on teenagers, will be felt for many years to come. And I think that is one of our big challenges is how do we work together? How do we come together in an interprofessional way to really ensure that we are doing what we can to not only address those needs, but to prepare for what will be needed down the road, because this is our opportunity. And this is where, as the public health person, sometimes in certain settings, I lose a lot of friends because I have to say, like, unfortunately, there will be other pandemics. We know that. That is just the nature of the way that our world is evolving. We learned a lot through this past pandemic, but one of the big lessons was if you were sick going into the pandemic, you were going to be much more likely to have a poor outcome. This is our opportunity to help people become as healthy as possible, to help communities become as healthy as possible. So when that next public health emergency arises, we're going to have the best shot at having a good outcome through that. And that includes addressing the impact of the pandemic that we all just came through and are still going through, because COVID is still, it still is and will be a part of our lives for the foreseeable future.
Yes. So one point I want to make about the mental health space, we need more providers of color in mental health. I think it can be particularly hard for people of color, especially men of color, to go to a mental health provider and talk about the things they're going through with someone who they feel like can't understand the things that they've gone to, who doesn't understand their experiences.
This was so many great points made. I'm just gonna quickly, I hope that people are we're learning a lot right now. So I just want to touch on some of the kind of issues that you all mentioned: access to care, gun violence. I'm gonna ask Kirby to shout out those genetic markers that men of color should be getting tested for. Perhaps just throwing this out there, Brothers in Public Health highlighting the impact on diabetes on men of color, comorbidities and the impact that has, diabetes and depression, simply that, going into COVID and not having access to testing, but even beyond that, testing to diabetes, testing to colonoscopies, breast cancer, so many things that we need access to care for. And unfortunately, we don't have men of color, brothers of color in our workforce. We don't have enough of them. So I'm going to throw it back to you all. How do we build that inclusive environment to attract more people of color to these spaces?
Well, one thing I'll say, I think a lot of times institutions and organizations will focus a lot on recruitment of people of color and men of color, but don't focus enough on retention of men of color and really building an environment where men of color want to stay and where men of color can really grow and advance. And I would say for me in particular, my favorite retention strategy is the implementation of employee resource groups. So for those that are unfamiliar with employee resource groups, they're basically groups where people that share an identity are able to come together, plan events, and network as well. So at the Mass League of Community Health Centers, we currently have a BIPOC employee resource group meant to support Black and Indigenous people of color. And we also have a women's employee resource group. And I actually met Darwin, our moderator, through our BIPOC employee resource group. So that really shows you like the power of networking that can come from these groups.
So it's a great point about retention. There are probably 2 or 3 things that immediately come to mind. The first actually is it goes back to a conversation that I was having just before we all started, and we were talking about mentors and having a good mentor and the important role that can play. And I can say early in my career, I had an amazing mentor when I was at the DPH who to this day is a close colleague, and we continue to work together. But that individual was incredibly influential in terms of really helping me see different pathways and always just sort of being there as a support. And that having that support system, having someone there to bounce ideas off of, or to, you know, to be a guide, or to help understand what opportunities might be out there is incredibly important, because sometimes that can be the key missing piece. The other piece, and we see this even now, the number of times as a faculty member here, I have been on a search committee for faculty positions, and we've been, you know, scratching our heads as to why we do not have a diverse pool of applicants for faculty. The answer is clear. We don't have a diverse pool of applicants because the pathways to get to doctoral programs, the pathways to pursue careers in academia, are not always accessible, and or that we're not doing enough to make those pathways as accessible as possible to individuals who want to pursue those careers. How do we start early? Starting in college or grad school can be too late, right? We need to start in middle school and elementary school so that individuals understand, you know, that this is something that I want to do. This is a pathway that I can do. And to create the supports around them to really help them down that pathway. That is an incredibly important way for us. You know, as we think about how we're going to have a diverse workforce 10 or 20 years from now, this is the time to start. And the time to start is in the middle schools and elementary schools and high schools all around us right now. And then the other piece is really understanding what the barriers are. Sometimes something as simple as a job description for a job posting can impose really significant barriers. The number of times where we've seen job postings, and I myself have been guilty of putting together a job posting where I've said, you know, an MPH is required. Is it really? Probably not. You could have 15 years of work experience that is going to bring far more experience than the MPH. Savion, you probably don't want to hear this, but you know, you're probably not going to remember a ton of what you learned in epidemiology class that you're going to apply to the work that you do 10 years from now. You might if you become an epidemiologist, but it's that experience that you accumulate that becomes such a powerful tool to the work that you do and the change that you can achieve. And that is what we need to focus on. And I think that's going to help us further, you know, create a more diverse workforce. I'll tell you.
I don't know if I have anything else to say because both Kirby and Neil actually really tapped it. But I will say, how do you do this? You start doing more events like these, and really build more community, help understand, and see which opportunities exist to bring more people outside of here to learn. I'm learning more from both Kirby and Neil, but I think in terms of your point, building and having events like these helps us understand which pathways do we actually put into place in order to create that essentially get more people into the field. And one example that I want to use, you mentioned going into middle schools. A term that as soon as I heard it, I fell in love with it. It is, how do we build more social capital? And social capital being, how do we actually embed more people that look like us in positions that and in places that we are going to. So for example, we are in 17 of Lynn Public Schools, and we are trying to build our career pathways by creating paid internships or fellowship for students to actually shadow some of our medical assistants, shadow our nurses, our provider, our behavioral health therapists. And those are opportunities so that they can understand, well, I can do this, and I have someone that looks like me, understands the processes and my experience, and can help me get to where I want, because there needs to be a start, right? And often is that the first job, but I don't think we have built enough opportunities at our schools or where we all are to ensure that they understand that these are things that you can do. So going more upstream, definitely. I think right now, Kirby mentioned workforce and the lack of a diverse workforce, particularly for mental health providers. And it totally resonates with me, because it's been a challenge throughout before the pandemic, and now that we're today. And as a Latino and English being my second language, I totally understand that going to a therapist is actually a little bit more difficult to process your emotions, talk about what's wrong, or even just kind of problem solve on things in a language that's not yours. It just doesn't necessarily as well. Or someone that doesn't know your experience, might speak the same language, but does not know your background or your culture. And I think what we're doing now, with the help of the mass leagues and a lot of other partners, is how are we looking at academic institutions to help us diversify that workforce? So today we have programs that ensure that we are providing paid internships for behavioral health therapists and psychiatric prescribers that are of color, to train at our health centers to ideally help them understand what it is to be working at a community-based setting, at a school-based health center, but also to understand what is it that really gives you joy in that work, and what is the passion, so that we can retain you. Clearly incentivizing with financial with salary is one thing, but I think there's something else that taps into our passion that we want to build upon. But I think currently we're trying to expand our workforce by doing that and being intentional about the level of trainees and the people that we recruit. But it's challenging too. What you said about our job descriptions and what you said about our policies resonates with me as well, because I will say often I've had to say we need to revise this job description for a community health worker, because the qualifications, you're saying a bachelor's degree, like that's not the people that we're essentially trying to recruit. But we're tied to these regulations and old policies. So how do we look at those, look at ourselves in our organizations to remove those barriers and provide more access of people to get into these roles? So a little bit into the upstream, a little bit about the current state, and all of that in between is where we're trying to figure out.
Thank you all. So just again, going to highlight some great things that you're all mentioning, but highlighting the fact that we need that power of community, that power of connection, and in the workspace simply through employee resource groups. But beyond that, we need to be engaging the workforce. We need to be engaging our communities from the beginning, starting in middle schools, high schools, even those students that aren't in those spaces, those who are at-risk youth. We need to be thinking about our communities holistically, because again, bringing it back to this dimension of public health being so broad and so intersectional. So we need to, how do we continue to engage all these intersecting industries, bringing in higher education and colleges and universities to partner with our communities and the public health industry. So to all those points that you're all making, what do your organizations, and even broader, what do public health organizations need to be doing to make this happen, to address the root issue, which is our social determinants of health?
It's always nice to have a softball question like that. So, it's for sure. So there are a few things that we are doing. There are a lot of things that we should be doing. So one of the things, so at Northeastern, we've been paying a lot of attention to job descriptions, to postings. So when we post a faculty position, we have to have a diversity plan that is submitted before it is even approved. And really being intentional about making sure that we're reaching out to a broad range of partners and organizations, and making sure that we are raising the visibility of the opportunities that we have here across all communities and all sectors. As we think about the content, making sure, so for for hiring for a staff position, making sure that the qualifications are really the qualifications that are needed, and not putting barriers in those. But the bigger thing is, as I think about our public health program, we're constantly thinking about how we can create models of public health education that will be accessible. So not just having an online program, but thinking about the cost of the program. When we have classes that are on campus, all of our classes on campus are in the evenings. As faculty, making sure that we recognize that individuals who are in our classes have other responsibilities. They have other things that are going on in their lives. And we certainly saw that during the pandemic. But this is just like their day-to-day realities that everybody is dealing with as they're going about whatever it is that they're doing. So sometimes just being responsive to that and having that flexibility can make a big difference, because that flexibility sometimes can be the difference between staying on a pathway or being diverted off of a pathway. So really making sure that we do everything we can to keep individuals on the pathway to achieve their goal. And that's not always easy. And it's not always easy because sometimes the systems are the things that we have to change. And that's the other thing that we're focusing on. The other piece is really around partnerships and creating partnerships where employers make, the pursuit of a degree possible for their employees. How do we work together to create models so that either the cost is offset, individuals get time off to pursue degrees in whatever career it is that they want. But that makes a big difference too, because the reality is that individuals sometimes have to work full time. Oftentimes, will have to work full time while getting their degree. So how do we work with employers to make that possible, to increase opportunities there? And I think all of this is around, to the end of, how do we figure out all of the different ways in which we can create new opportunities, because that is what is needed, and create opportunities that are sustainable and do it intentionally, not just for the sake of doing it, but really mean it. And when we mean it, it means that we also have to make sacrifices on our end as the institutions, recognizing that we have the capacity to make those sacrifices. And I'm saying this 200 feet from my dean's office. So, but it is really important, because I think the institutions are the ones that oftentimes have the ability to knock down those barriers, but they're also the ones that have the systems that are put in place. And this gets to, the issue of social determinants and breaking those systems that allow disparities and inequities to perpetuate.
You want to go? Sure.
So I think public health is all about community. So having more events like these, putting together more organizations like Brothers in Public Health that can really highlight different health disparities that communities of colors are facing, I think that's key and very important. And continuing to build community with the work we're doing, whether that's in the workplace with employee resource groups, or again, professional organizations like these, where we can highlight different public health issues going on within our communities.
Yeah, I everything that's been said resonates. I think for me, it goes back to the term social capital. And I think in order to be able to do this, we need to be willing, and we need to look at ourselves, and we need to look at our organizations. And I think this taps into a lot of what's been shared up here. What are we doing that is creating those barriers? What are we doing that is not allowing us to bring more of that diverse workforce and attract more people? And I think I've been in more recent conversations with other colleagues around. So we want to ensure to diversify the workforce, and we provide at least more opportunities, but we need more leaders like these to be in our roles in order to do that, right? So not only are we creating those pathways, so how do we also allow for when they get into these roles, they get into these schools, to also offer them and provide them with the opportunities to get in these leadership positions, what it is to be like, and what it takes to do so. So being able to have that more available, but what does that take? Needs for us to, as organizations, academic institutions, wherever it is that you may be, look at ourselves. And it's not the greatest term, but essentially making the problem ugly, right? If you look at your data, you see who you have, and you see that your workforce or your employees are not diverse enough, that you don't have as many people of color in leadership positions versus non-leadership positions, is that takes that intentionality, because if we don't build that and provide that opportunity, we're gonna get a little bit, we're still gonna be a little stuck, right? So how do we as leaders provide that in our own institutions? How do you as future leaders continue to take your experiences and put them out there so that people can learn? So I think looking at ourselves, not only as providing that first opportunity or that pathway, but also enhancing it for people to have opportunities to become those leaders that we more need, people, leaders of color.
I love what you said about looking at ourselves as organizations. I feel like that is a very key concept. And I think a very important way to do that is having like cultural competency trainings for your staff, having diversity, equity, inclusion trainings for your staff, so staff can really understand racism. I think if you're going to work in this field, you need to understand racism, what it looks like, and how it shows up in public health, in the workplace. I think staff need to understand, the different concepts that can really impact men of color in the workplace, implicit bias, microaggressions, how these things show up in the workplace, and the type of impact that they can have.
Thank you all. I'm going to summarize a lot of what you said in one quote that I got from this book that I'm reading right now about community health centers, written by Bonnie Lefkowitz, if you want to look it up. But it's pay now or pay greater later. I'm going to say that again, pay now or pay greater later. So we need to be innovative. So revising those job descriptions to create new opportunities, building social capital for us. So that's following up after you network with someone. That's joining and going to joining ERGs at your organization, attending events like these, and finding those career pathways. So with that, I'm going to ask you all, I want to open it up for we have 5 minutes because I know that we have, there's another event after this. But if you can each say just like one piece of advice that you would give somebody, your younger self, entering this public health.
The piece of advice that I would give to any young person that's looking to have a career in public health would be to invest in your education. I think there's a lot of different educational trajectories you could take to end up in public health. You could pursue like a traditional public health degree. You could pursue a business degree. You could pursue a social work degree. But I think it's important to invest in your education in some way.
Looking back, thank you for that question. Don't be afraid to ask, and ask about anything that you're curious about. Ask about that position that just called out at you that you saw on a job posting. Ask about something that opened up in your organization. Ask about anything. If you're going to school and you're looking at a director role, don't think that you will always learn something from it. And even if it's just you applied for a job that you felt that you weren't qualified, but you went through an interview, guess what? You get to learn. You get to learn more about yourself because they're asking about you. So don't be afraid. Aim high, and the worst that you can get is a no.
I love both of those pieces of advice. In public health, we're often talking about tackling these big issues, and that can be daunting. And the one piece of advice that I would give is that no problem is too large for one person to play a role in solving it. And so if this is what you want to do, pursue that dream. Surround yourself with people, or find one person who will help you and support you and mentor you on that journey. and stay on that journey, because you will have the opportunity to make a difference. You will be able to make a difference in so many ways along that journey, because every problem there's a role for everyone to solve every one of the problems that we're facing right now. It's just a question of putting yourself on that pathway.
Thank you. And I just want to quickly apologize and say I framed that question wrong by saying a young person or somebody just entering, because it's never too late. So we're going to take one question from the audience and one I saw Zoom questions were coming in. And then we'll close.
Mireille Hanif, Director of Programs at Leadership Brainary. And I love that you all touch base on getting those graduate degrees that will allow you a seat at the table, basically, to make the decisions that you all are talking about. For example, as you mentioned, looking at those job descriptions, creating those spaces, is usually the people that know what that is like, that have those experiences, that think about those solutions. Just to give you a little bit of a background on Leadership Brainary, we're an organization that addresses the inequitable access to master's and doctoral degrees for underrepresented talent. And so it's something that we are currently working on. As a young organization, they're 6 years old, but we've made a lot of progress. And so in bringing all this talent, this underrepresented talent, I think, how would you phrase it to individuals, the importance of having that seat at the table, of being the people who bring that decision, of the answers and the prospects of how do we bring more diversity into the workforce? Because without that seat at the table, how do you?
Excellent. Well, I will do my best to answer that, and thank you for sharing. I think what from the little that you share, it sounds like amazing work that you're doing. So if I understood it, how do you actually, without being at the table, you actually provide the opportunity for them to advocate to be at the table? If I'm summarizing a little bit correctly. I don't have a perfect answer. I think from my experience, it took a while, and it took how to learn and how to maneuver, given that my experience was definitely different than the colleagues that I have, particularly here in Boston. But we do now in the efforts to diversify a lot of our underrepresented communities. We have a specific experience that can feed into what organizations are looking to do. So how do we allow for those folks to be able to share that experience and with people like us, in order to inform and be better equipped to be able to provide them with those opportunities? But I think, because you're right, I think it really resonated with me. It's like, how about not being at the table that you're at right now? You provide the knowledge and facilitate more people to be able to get in our roles. So hope that makes sense. But I think in terms of just reflecting back on my experience, it's something that would definitely have to think through, and I'd love to talk to you more about your work.
Yeah, so just to chime in on that, I think it's important to have a seat at the table, because it's important to be part of those conversations that affect you and the people that look like you. And I'm going to take a quote from our CEO at the Mass League, who's sitting in the back right now. If you're not at the table, you're on the menu.
It's a great quote. I think there are two things that that we can do. The first is to advocate for those who are not at the table, to really find ways to create pathways for more individuals to be at the table, to help everyone understand that their voice is important and should be heard, and to channel those voices when you are at the table. I think once you gain a seat at the table, you have an obligation to advocate as hard as you can for those who are not represented at that table, and to make sure that the table gets bigger and is more representative. And I think that is what leads to sort of better health and kind of health defined broadly for everyone. But the unfortunate thing is that the tables are created in a way right now where not everyone gets a seat at the table. And sometimes it's the ones who are, who have the loudest voice or the most influence, or, the few key folks who are always at the table are the ones who are making those decisions. So as more and more people get to that table, to advocate for that table to get bigger. And I think that's so much of what we've been talking about this evening. How do we create those opportunities and create those pathways? I think once you get into a position where you have that chance to create more opportunities for others, it's your obligation, it's our obligation collectively to work together to do that, because that's how we'll achieve what you were talking about. So that's a great question. Thank you for that.
Thank you. And we're going to take one more remote question. I want to be respectful of people's time, though. If you are in person or joining us on Zoom, we did say that the event was until 7. So if you do need to step out, just want to be mindful of your time. There's a bracelet and stickers in the back that you can grab on your way out, by the way. But the question that we're taking that came in online was, given that Johns Hopkins and Oregon have pleaded their commitment to DEI, however, both fired their chief DEI officers, how do you reconcile these actions with their values and with the loss of distrust from communities of color? Should institutions genuinely commit to dismantling systemic racism, or should using racial equity as a talking point without meaningful action? That was, yeah, like, wow.
You want to come in here, Michael?
All right, I'll take a shot at trying to answer that. I think one of the things that is certainly an elephant in the room throughout this conversation is the fact that as we're talking about increasing diversity in the workforce, in the public health and healthcare workforce, as we're talking about creating more equitable pathways, more pathways to careers, as we're talking about creating more equity, it is in the face of a significant backlash against DEI efforts around the country. Unfortunately, this work has become incredibly politicized. Public health has become incredibly politicized. Through the pandemic, throughout most of my 25-year career, I used to try to separate the two. And it became clear that we can't. We have to take it head on. And that means that when we see institutions like Johns Hopkins or other institutions or other organizations and companies start to walk back their commitment to DEI, that's where we have to step forward and advocate hard for why DEI is important and the benefits to everyone from that are derived from investing in DEI. This isn't a political whim. It's not, something that's like, the flavor of the month that like, hey, this is something we're going to focus on today. This is important work. This is work that transforms lives. And I think part of it is just stripping away the jargon around this and talking about what the work really means, why it's important, and what everyone gets from this, how it benefits individuals and families and communities. And sometimes it's about sort of getting people to eat the broccoli without letting them know that it's broccoli. No offense for anyone who likes broccoli. But I think it is hard because we're practicing this work in a very politicized environment. And that's sort of the reality of the work that we're doing and the environment that we're in. But it shouldn't stop us. It should instead fuel us to work harder at what we're doing.
Yeah, I'm going to go after Neil because I think that was actually a perfect, kind of segue into what I was thinking, which is building upon it. When big organizations like these, or even smaller or local that express commitment to DEI, and these kind of things happen, I totally agree. We should continue doing it, but how do we do it? I'll use examples of building partnerships, and you as an individual, how do you carry the work along so that you can inspire more of the work external from what you're doing, but that you feel like your commitment is still there and essentially inspire. So an example that I shared with you guys at the beginning, I'm also a member of the Health Equity Compact, which otherwise the work that we're doing across the state and across industry has inspired to get with people that I otherwise would not have met, from a foundation over in Western Mass, or another medical institution in Central Mass in Worcester. So how do we do our work individually, but how do we tap into some of the things that continue to drive the work forward at the advocacy level, at the state level, at the policy level, independent of what things may have stopped or continue out of your own organization. So I know it doesn't answer in terms of like the larger institutions like Johns Hopkins and others that were mentioned in terms of how do you actually continue to work forward. But I think we have a commitment to ourselves and to the work that we're doing. If we really want to drive it forward, how do we do it outside of the realms of what you're tied into your day-to-day, quote unquote?
So I won't speak too much to the situations reference, just because I would have to read up more about them and really understand the details. But one thing I will say, when it comes to DEI, it's important to walk the walk, not just talk the talk. You can't just post a DEI statement on your website and think that's it. There has to be solid action and programming behind it.
Thank you all. Round of applause, celebrations. Thank you all so much for taking the time to join us today and share knowledge. You were spitting facts. If we're starting, we're growing. If you want to donate, no pressure. That's just if you want to donate. But I do want to just specific to the Greater Boston. This is the Greater Boston chapter that we're just launching. Carlos spoke on, I want to highlight two things that are happening just for us. Carlos mentioned the Health Equity Compact. Learn about it, read about it, see how we're making a difference and we're moving a needle on diversifying leadership, diversifying the workforce, and truly moving the needle on health equity. And two, unintentionally, the organizations that we all represent have collectively supported a career pathway already, with high school students engaging with the Mass League and the Youth Health Advisory Council, and having the opportunity to even participate in the Northeastern Summer Enrichment Program. So talking about education access and figuring out what those pathways are, we're doing it. Y'all are doing it. We're doing it. We're all in this room doing it. So thank you again for joining us, and stay tuned for future events. We definitely want to stay connected with you all that joined us here remotely. So thank you again.
Thank you. Before we go,
Good to meet you too.
Great to meet you. Great to meet you as well.
Yeah, thank you.
So
Thank
stay
you
in touch
too.
for sure.
For sure.
Thanks.
Appreciate it.
Yeah, make sure you grab like a bracelet. Pleasure. Thank you for inviting me. It's really learn a lot. Yeah, please follow. I'll ping you on LinkedIn. Let me, connect. Find time to grab. That one's off.